This past week, we've gotten some eye-opening data from the NCSBN from their NCLEX conference. And this is one that every program needs to tune into. I'm here with Becky, our Vice President of Curriculum and Faculty. She's a nurse practitioner, and she has been attending the NCLEX conference on our behalf so she can give you all of the news. She's got the inside scoop, and we're covering it today on the Nursing Navigator.
Nursing Navigator's here. Wipe away those study tears. Hurst Review's got your back. Listen close, stay on track.
Becky, we know that nursing faculty are looking at their Q3 numbers thinking, what the heck is happening? Because the NCSBN reported on it, and they also gave some insights as to what to expect in Q4, which we will get into. But during the NCLEX conference, what did the NCSBN address when it came to pass rates in general?
Well, during one of the sessions, they presented the Q3 pass rates that they had just posted like the week before the conference. And what we saw for RN students that are first-time test takers is that their pass rates in Q3 this year dropped by 5%. Mm-hmm. In Q2, they had been around 89%, and they dropped to 84%. So that is definitely a significant change, and not something that, as faculty in nursing programs that we like to see happening. The good news from what they posted was that the PN students actually went up a tiny bit from what their numbers were in Q2. In Q1 and Q2, PN students across the nation for first-time test takers were at 86% earlier this year, and now they are at 89%. Overall, what that gives us is 87% for both RN and PN students across the year so far. And that is a number that actually is kind of a trend of what we have seen in times past. In fact, they did mention during the conference that we are back to pre-COVID numbers as far as our national pass rates. And that's a good thing, because that is where we kind of like to see that trend, especially within about 2.5 years after a test plan change.
We like looking at the numbers.
We do.
You especially love looking
Yes.
at the numbers because it gives us a lot of insight. We're going to get more into trends here a little bit later on. Can you give a little bit of historical background as to what those trends were during COVID times?
Yes, I'd be glad to. What we saw during COVID was not exactly what we like to see. In fact, NCLEX pass rates nationally during COVID dropped. And of course, that was very frightening to students and faculty. But what happened during that time was they dropped the number of questions that were actually on the exam. Of course, that made sense during those times when infection control was on everybody's priority list. So it reduced the amount of time that was necessary for the student to actually be in the testing center. We went from, with the RN students, they used to have a total of 265 questions to 145. And then for PNs, it was 215 and dropped to the same number. The other was just simply the learning environments that changed. We couldn't get into clinical sites because of all the infection controls and parameters there. Students were doing a lot more in sim labs, and they were learning online for the most part, instead of actually having hands-on in a lab or in an actual clinical setting and classroom setting for those learning experiences. It changed the world, as we all know, and it also impacted students' ability to really be able to be successful on the exam. So we don't want to go back to those days, but that is why they were very glad and happy to point out during the conference that we have achieved right back at those pre-COVID numbers that we trended and saw for many, many years in the pass rates overall.
It's getting us back to the old normal. Remember during COVID, we talked a lot about, well, this is the new normal for this time being. So anytime that we can kind of go back and get to the trends and patterns that were consistent without having this huge, once in a lifetime pandemic happen is always a good sign.
Yes.
But I think one thing is important to acknowledge when it comes to the NCSBN saying this is what we suggest to prepare for the NCLEX, it really remained the same. 50 to 100 hours for recommended study time, and there's a few others too. Why don't you bring our listeners up to speed on what the recommendation is?
NCSBN has always said, and this is from research that they did several years ago, that students who are successful the first time on the NCLEX are those students that have taken a structured review and have committed at least 50 to 100 hours of study time in order to be prepared. And that still is tried and true. That is still exactly what we recommend, and everything that they say, as far as supporting students and the recommendations for getting prepared properly so they can have that success. So that is that's always something that is important for faculty to just reiterate with students and to reinforce in their processes and in their curriculums.
That might be a really friendly reminder as we are heading into Q4, knowing what the Q3 data looks like.
Yes.
There is a lot of time and energy put into dedicated study time after completing a review to help boost those Q4 numbers.
Definitely. And historically, what we have seen, and this is what's important for faculty to kind of grasp and be prepared for as they start this new semester this year, is Q4 numbers typically trend down even more. A lot of variables that play into that, but that is, if you look back over the years, oftentimes those Q4 numbers are the lowest out of all 4 quarters during the year. So we don't want to see that drastic drop again, since we already have seen a drop so far. But the best way to defeat that trend, so to speak, is always get your students ready with a structured review and those a minimum of 50 to 100 hours of study time. That's what leads to success, and that's what we know is important for students to grasp. Just because those numbers were very high the last couple of years when they made the change with the Next Gen exam does not mean that they can get lazy about that. They have to stay on task and they have to study.
So as we head into Q4, what does this mean for faculty who are looking at their own program statistics, their own data right now?
Well, it doesn't mean they have to do major curriculum changes, because that's a big task. I know that just from my years of experience as a nursing educator. What it does mean is that they need to stay focused with what they're doing with their students and build in those structured processes for prep, not just after graduation, but throughout that final semester particularly. But actually from the very beginning of their curriculums, from fundamentals on all the way to, their high-level med-surg courses, always try to reinforce those client needs categories, like in their testing structures. And always, of course, we know the big word and important word now is clinical judgment. So we always want to reinforce those critical thinking processes that then lead to clinical judgment and that high-level thinking that nurses need to have once they graduate and transition into that first job after nursing school. The great news is Hearst has a 99.8% pass rate with both our RN and PN reviews. And we're very, very excited about that.
And that's recent. We were at a 98% pass rate, which is also incredible. Mm-hmm. But the fact that now we're at a 99.8 is even all the more reason to celebrate.
Yes, we love that, because that data is based on students that took Hearst Review since the Next Gen, the 2023 Next Gen test plan went into effect. And of course, all of our materials are updated and congruent with everything in those guidelines and in that current test plan. So we're very happy about that.
We know that there's a new test plan coming out. That was a big topic of conversation during the NCLEX conference last week. So when it comes to what to expect in 2026 through 2029,
right.
And with doing that, we can start by addressing the elephant in the room. NCLEX at home. I know that this has been circulating online really like crazy over the last few weeks, but it's not new information. We knew this from last year's fall NCLEX forum that they had initially teased it. But now as we're kind of approaching the new test plan, and now there's a landing page online that addresses NCLEX at home, I'm sure that this was at the top of everybody's list on wanting to gather information. We know that there was some information shared, maybe not to the extent that we had hoped, but let's bring our listeners up to speed because I know that they're going to want to know.
Definitely. And you're right. During the conference in the chat, that was just about the only question that was being asked for a little while.
At home. What is going on?
Until they finally answered it. But last year, right before this same conference that they have every year, they had posted a nice little video about, look what we're working on. And it was that initial announcement about the possibility of developing a process where students could take the NCLEX at home.
So if there hasn't been a released timeline yet, why is everybody so obsessed with this NCLEX at home topic now?
It's come back to all the discussion boards and blogs and forums and, and a lot of social media talk about it recently. And I think part of that probably came from the fact that the conference was last week and that next year is a test plan. And so oftentimes, historically, when NCSBN makes big changes, it is during a test plan. And I think that may be part of why it's being discussed so much. But the news of the day is that they are still working on this project. It is still in development, and they have not set a launch date for NCLEX at home yet. So I think everybody can take a deep breath and go, oh, okay, but still kind of keep it on your radar because it is something that as time goes on, if that is fully developed, and I'm sure I can't imagine all of the technology and behind the scenes test security type things that have to be done in order to develop that appropriately, but they will do it if it's doable. And it will be something that will be a game changer for students, particularly students that perhaps live far away from test sites and testing centers. We have a lot of international students that come into the United States, often after working in their own countries, but yet they still have to take the NCLEX when they come to the United States in order to be licensed and practice here. So I think in those situations, it might be something that would be very helpful to them, but there's a lot that has to happen between now and when that actually happens for it to be safe, because that's the top of the list is testing security in that environment. One thing that I'm sure many faculty have talked about and thought about as well is what does that look like? And is that actually going to be more of an anxiety-provoking environment than it would be if they went to a testing center? Because let's face it, if for some reason, I don't know, your cat ran across the room while you were taking the test, or something moved in the room.
Your internet goes out,
Your
power
internet
shortages.
goes out. And all those variables that could change in that environment that would trigger, I'm sure, either a pause or a shutdown of the test, then how terrible would that be for something that wasn't in the control of the student while that test was going on, that could be a trigger for it being much more high stakes than it already is. For me personally, I think that would be tough. But we shall see, because they did not announce a date to launch it, which tells me there's a lot of work still to be done for that to happen.
Which is great that they are taking the time to not rush into something that is this groundbreaking for the nursing world. Not only for students, but for instructors. How are they going to teach and kind of retrain students for this option? Existing nurses, coming in, or those that maybe took the test as a PN at the testing center, but now this is a new option. So there's so many variables here, and the fact that the NCSBN said there's no timeline could be a little bit reassuring that we still have a lot to work through and we're not going to rush into this. But that's really all the answers that they gave, right?
I think so. So if I were nursing faculty full-time now, I would take a deep breath. And I also would still stay focused on what I know a lot of faculty are already dealing with, and that is academic honesty and integrity, even in their educational systems right now. And I think what we do, especially in the field of nursing, as a healthcare and caring profession, is we do everything we can to instill integrity with our students in everything that they do.
Yep.
I think that's the direction to go with that, regardless of how this test is administered in the future. Because that nurse that's standing at my bedside, I want him or her to be top-notch honest and have lots of integrity and professionalism in everything that they're doing. So I think that's the sort of things that we can reinforce ahead of time, regardless of how they take the test.
Me too.
Yes. I think we all agree on that for sure.
Definitely.
So we don't have a launch date for NCLEX at Home, but there are some things that we did learn during the conference that we do know. In December, there will be more information coming as well. So
some more to come on that.
More to come on that.
In that case, let's shift to what we do know, specifically about the 2026 test plan. Because newsflash, we are in a test plan change come spring of next year.
Yeah, April 1st of 2026, yes.
And there's some good news for some curriculum committees out there. Please share with us the good news, Becky.
I love sharing this kind of news. They did announce during the conference that there are no changes to the percentages of the client needs categories for both the RN and PN test plan for 2026. Hallelujah.
Yay!
They did say and notated that there are a few activity statements, which are just, the responsibilities of what nurses do in those different categories that they have added. And this is all based on the practice analysis survey they posted in 2024.
The big one?
The big one.
I know you carry that stack with you.
You know I do.
And it's printed off. We've got copies in every room.
Let's
show the viewers.
So this is the RN, the 2024 RN practice analysis. It is 275 pages.
She's thick.
Yes. And this is the 2024 PN practice analysis survey results. It's 136 pages, but still a lot of very valuable information in these documents. It's full of a lot of details about what they found when they sent the surveys to nurses that are working now and what they spend their day. What's the day in the life of a nurse and how they spend their time in all of these different areas that are on the test, the client needs categories, and then, of course, clinical judgment. Management of care and coordinative care, of course, are always some of the top percentages that are on the exam. And for RN nurses, they will be adding one new activity statement in management of care, one in pharmacology, and parenteral therapies is the category, and then also in physiological adaptation. So 3 new activity statements for RNs across their test plan. For the PN students, there is 1 new activity statement that they will be adding in coordinated care, because again, that's one of the top categories. And they also are adding 2 new activity statements in reduction of risk, but then removing 1 that is actually there right now. What the details of those activity statements are, we won't know until December when they post all the details of the updates and changes for the test plan. But that's something to look forward to. And it also is something to take a big sigh of relief because faculty do not have to change their curriculums.
And students don't have to kind of panic thinking,
Right.
This is changing. I'm kind of in that graduation, preparing time. So they don't have to learn or absorb anything
Absolutely.
new.
It means their curriculums and all that they have been doing are really even still going to match that test. Even if they're a December or January graduate and don't get a chance to take the test until after the new test plan change, there just won't be a large difference in the way those categories and the percentages of those questions are on the test. So that should make everybody feel a whole lot better.
That's why we say it's good news.
Yes.
And we like to celebrate.
Definitely. But this really is very interesting reading and good for educators to take some time at some point along the way just to look and see what all information they derive from sending out those surveys, because this is what drives any kind of changes that they do make every 3 years to the test plan. So it is important for us to just have an idea of what's going on and this results that they get from the surveys.
I know you and your team spend a lot of time going through that.
We do.
And when there's more released in December, you'll spend a lot of time going through it. And you do a great
Definitely.
job informing everybody else about
Thank you.
what changed, what's the same, what was updated, what is no longer. So we look forward to bringing you back
Okay.
to keep our listeners engaged and informed, because we know that clickbait is real. People like to kind of blow some stuff out of proportion or speculate, but all we are doing here is reporting the facts of what we know. In this, it defines an entry-level nurse.
It does.
And we like to, in the past, in some previous episodes, we have said like in the first 6 months. It feels like a safe number, but really an entry-level nurse, according to the NCSBN with the studies that they've done, is anywhere from 0 to 12 months. And they provided some pretty in-depth reasoning as to why that is the case. Please enlighten our listeners why it's 12 months or less.
Yes. And you're right. It used to be 6 months years ago. That was the definition of the entry-level nurse. But things have changed a good bit in times past, where hospitals now especially have very organized and structured orientation, even residency programs. And so a lot of times the new graduate, after they pass their NCLEX, or even as they are getting ready to pass their NCLEX, have already entered into a very structured anywhere from 13 to 16 week type orientation program. And they work with preceptors, and they're not just thrown out there on their own to do everything by themselves. In fact, the statistics that NCSBN shared during the conference were about 97% of new graduates actually start in a structured residency program to get them onboarded for that new job and to also make that transition into practice in a very safe and structured way, which I am fully agree with. I think that is definitely really important for the success of that nurse, and also to just not feel like he or she is out there by themselves and, just trying to figure things out on their own. So
yeah, you're just thrown to the wolves. This is more structured.
Role modeling and working with preceptors has always been a wonderful way for, particularly in healthcare, for us to transition into a practice position. So fortunately, that is the trend, which then leads to the fact that over the past few years now, the entry-level nurse definition is the nurse that has been in practice for 12 months or less. And those are the nurses that also were surveyed to get the results about what's happening in the day of the life of a nurse. Where are they spending the priority of their time? Where are they, focusing as far as their care with their patients? And how does that drive what's important for NCSBN to test the new nurse and prepare them for licensure? So it all makes sense when you kind of follow the process of how it happens. But yes, the brand new nurse, so to speak, is not just a few weeks or a couple of months of practice. It is now 12 months or less.
That evolves over time. I'm curious if you are a faculty or a new nurse, or maybe you've got a little bit of time behind you. What was your orientation and onboarding like? And what do you think about this continued 12 months or less as a new nurse with these longer onboarding and orientation programs? Let us know in the comments. We're always looking to hear from you.
Yes, definitely, because that has definitely changed over time. The good news is that NCSBN is not trying to trick anybody. They are trying to ensure that new graduates become safe nurses and that they can provide safe care to every patient that they take care of. If you are doing well in your preparation of students for that, then keep on keeping on. Any changes they make will feel evolutionary, not revolutionary. So use this time to strengthen what you are doing and what you know already works. And don't worry about the unknowns. We have to stay focused and get our students and nurses ready to transition into safe nursing practice.
Becky, thank you so much for coming on and sharing your wealth of knowledge with our listeners. I'm excited for 2026. But as we head towards that test plan change, we just want you to remember that the core content is not going to change. Safe practice, clinical judgment, and strong preparation will carry your students through any adjustments that the NCSBN might throw at us, which we will know more in December. And we will bring Becky back to bring everybody up to speed with the official updates in just a few short months. In the meantime, double down on what you know works. The best way to prepare for the future is to teach excellent nursing today. Until then, future nurses,
Current nurses and educators,
and retired nurses, thanks for tuning in to the Nursing Navigator by Hearst Review.
Guiding you through from school to the floor, nursing news, careers, and so much more. Learning, growing, passing the test. With Nursing Navigator, you'll be your best. Nursing Navigator's here.